In Guanajuato state, to the north of the capital, officials say 52 local students who returned from studying in China remain in quarantine, supervised by public health authorities. That's in line with COVID-19 protocol that dictates screening for all those coming into the country from China and a mandatory 2-week quarantine for those arriving from the Hubei province epicenter.
We have a well-established contingency plan to confront the coronavirus in case of cases beginning to appear. It's similar to the outbreak of influenza, which we saw in 2009. We have to monitor how the virus spreads, and while we don't exaggerate the danger, we must be extreme in our precautions.
Dr. Alejandro Macias was the Mexican government's influenza commissioner during that 2009 pandemic and says the country learned from that experience.
We have the time. We have a grace period that China didn't have this time. In 2009, we didn't have the time. Now we have it.
He also pointed to the 2003 SARS epidemic, another coronavirus that originated in China, sickened thousands, but ran its course and disappeared within months. Mexico dodged that outbreak, and Dr. Macias is hoping the same will be said about COVID-19.
When we were waiting for its arrival, it went to zero. It just disappeared. But hope is not a good plan of preparation. We should be now tuning our infection control units, tuning our intensive care units.
But Dr. Macias says he's not seeing the level of institutional readiness he'd like, and should an outbreak arrive here, he worries too many Mexicans are not healthy enough to withstand infection.
The best preparation you may have is to be in good shape. And I think that we are not very well prepared in that area, because Mexico is currently going through an epidemic of overweight. We better get prepared, because we will have a hard time. Hopefully, as I said, this virus behaves.
With no idea if or when the coronavirus may arrive in the country or how it may spread once it does, Mexico is doing the same as many other countries, looking back to what's been learned from previous disease outbreaks and preparing to contribute as it can to global antiviral efforts. Alasdair, Baverstock, CGTN, Leon, Mexico.